My name is Nicole, and I was looking for a plastic surgeon to help fix the under eye bags I had. As I was getting older, I noticed that my eyes looked more tired, and I wanted them to be rejuvenated. Well, I tried filler before. The filler worked great, but it's temporary, and I also feel like the effects long-term just aren't what I want. I'd rather have something more permanent in my natural skin to be rejuvenated, not just like a Band-Aid. I ended up getting a fat transfer to my lower eyelid to plumpen up under the eyes and make it more youthful, to give back the collagen and fat that you lose over the years. And then it's a more permanent fix than just using a filler every year or so. You save money in the long run.
So just talk us through the whole process. So you had this thing at the beginning where you were like, okay, yeah, I'm looking in the mirror and I want something. From there, just in your own words, what happened? Like, how did you go through the process? How'd you end up here? How was the procedure?
Okay, so in the beginning, I just felt like I was looking really old, and I wanted to find a doctor who could help make me look more youthful. And so I started the search online, and I came across Dr. Athré, and I really liked his website and his Instagram, so I made the appointment, and then I came in. I thought I would need like something else done for the lower eye, but he's like, no, you need a fat transfer to plump it up, you know, underneath your eye, and the CO2 laser to help get rid of the fine lines and wrinkles. And I've heard of the CO2 laser before, and I've been interested in that as well. So I set up my appointment. I was excited. Not really nervous, just because I knew that I'd be under local anesthesia, so I would know what was going on. And he talked me through the steps, so I knew what was happening every time, or what was going to be expected, like the next like incision or whatever it would be. And then after the procedure, I wasn't really in any pain. I was able to walk. I felt fine. I did want to rest though. And then I went home, and I didn't wash my face until the next morning, because I also had like microneedling with stem cells to help with the overall appearance of my skin. And then I started using the serum and a light moisturizer that I was given, and that helped with the healing process and the red light therapy, or elixir, I believe it's called, that they use here, that I would come every other day. And then I felt like I looked better, even though I had all redness under here and burning from the CO2 laser, but I could see that the fullness was back under my eye. And that was a very good feeling. You know, I felt like I regained my youth again.
Why I'm smiling is this. So I find that women are so detail oriented. Okay, my wife's the same way. So if I ask her to tell a story, so you guys use these details, like I used the serum, I did this after this. This is why I'm smiling, because it's cute to me. So you've crossed the Rubicon. Okay, so all of those ups and downs and all this kinds of stuff. Okay, first thing. Now, you've never had facial surgery before, so you don't have a benchmark to benchmark it against, right? But you are a researcher. You've seen stuff online, okay? and you had a very, and you can tell, you had a very intense laser treatment. I mean, you could
Yeah.
see it. It was not.
No, yeah, it definitely was.
It was not this little, hey, let's just lightly, da da da. Okay, I mean, it was, let's barbecue her. Okay. Despite that, okay, so this combination of protocols that we created for you, the skin, the serums, plus elixir, how do you think it helped, hurt, sped up, slowed down your post-operative period?
I think it all helped with the healing part, to follow the regimen, and to know after like 10 days I looked like completely like I hadn't had something, surgery or some kind of cosmetic surgery done under my eye. I could put makeup on. 10 days isn't really that long for the long-term effects that I'll have. And it's worth it. I highly recommend anyone to do that who feels that they need their eyes rejuvenated or to be lifted, because it fixes the problem and you don't have to worry about it every couple months if you need Botox or if you need to go get filler or if it migrates. It's an amazing procedure that it's amazing what they can do nowadays.
Do you think I'm the only person in Houston and only the second person in Texas that is really gung-ho about elixir, because I really like my patients to heal as quick as possible. I don't want to do less surgery and say, oh, you healed quickly, but realistically I did less surgery. I want to give you your result and I want you to heal quickly. Do you think the elixir helped the overall process?
I do. I'm a big believer in red light therapy, so it's like red light therapy on steroids. And I definitely feel that it helped because I could see the improvement every day.
Awesome. Sign off words to somebody else sitting in your shoes. Now, I'm going to tell you a little bit about you, and I'm probably going to embarrass you. Okay? You are not my standard patient. Okay? My standard patient is way more anxious than you are. Okay? Is way more nervous. Okay? And you were a tough cookie. Okay, so I'd say if there's a bell curve, you're definitely on the awesome patient category. Okay, so you're talking to the population. Sign off words on your experience, or you can say anything you want to somebody sitting at home researching.
I would just say do it. It's worth it. Pain is beauty and beauty is pain. And I just think it's the best procedure for under eyes, or even if you have like the hooded eyes, to get that surgery, because it will change your life.
What are you having done today?
Today I'm having a fat transfer to my lower eyelid and the CO2 laser.
Awesome. So how did you get here? Like, what is your story? Like, why did you, like, just talk about yourself. How did you get here?
Well, I noticed when I turned 40, I already had deep sunken eyes, and the hollowness just got worse, and it just aged me, and I wanted to look younger. I've tried other things like filler. It's a temporary fix. I also feel that it makes things worse because it just, once it comes out, it can migrate. I just had bad experiences, so I wanted more of a permanent fix.
So what kinds of problems were you facing with fillers?
Well, it seemed that the puffiness underneath my eye got worse than it was before. It had lasted for a while, but it just had migrated, and it just caused more of an issue. And then I tried Botox, But again, that would freeze different parts of my eye, so then it would look worse somewhere else, and I just wasn't happy with the results.
Cool. So what type of anesthesia are we doing today, and how do you feel about it?
Local anesthesia, so I'm not going completely under. I will be awake. I feel comfortable and confident that I'm in good hands.
Are you nervous at all?
No, I'm not nervous. Because I don't want to think about being nervous. I know that everything's going to go smooth. I did my research, and you're very thorough from the beginning to end with the regimen, like even before surgery, how to start and how to minimize the downs, like the bruising or the puffiness. So I'm feeling really good and confident about the procedure.
So most patients today probably have a million to maybe even more than a million choices of what to do in terms of, as you said, I had filler. So not only from a procedure standpoint, but also from a provider standpoint, there's 10 million. How are you here? What brought you in?
I've done my research. I've looked at Google, Instagram, I've watched videos, and I've talked to friends who've had different things done, and based on what I've seen on your Instagram, I really was happy with the results. I did comparisons, I've called other doctors, went and saw other doctors, and when I came here, I felt the most comfortable.
Awesome, we appreciate that. So one of the things that's on our schedule of events for today is Elixir, and we talked about Elixir preoperatively. Tell me kind of what your thoughts are, expectations, or things that you're looking forward to with respect to Elixir.
Well, it has a 30% recovery rate to help speed up the process. I also have my own red light at home. So to me, it's like the red light times 100 or more. So I'm really excited because I know how well the red light works. And so this is better than the red light. And it's the only one in Houston.
Awesome. Well, we're going to get started in just a little bit, so thank you so much.
Okay, thank you. Yeah, hold on.
Okay, I'm going to help you up. Okay? Hold up there for just a moment.
Okay,
Just let your body just equilibrate. You did awesome.
thank you. So did you.
Thank you. Is this the mutual self-admiration team? Okay. Hold on, don't move. Oi. All right, grab my hand. Swing your legs over. Okay, wait. Relax. You good? Okay. Now. All right, Elliot, come here. Okay. All right. And then have a seat. How do you feel?
Good.
Okay. Cold beats. All right. All right. So we are approximately 2.5 hours after we gave you some anesthesia. We finished our case. Okay. So how do you feel?
I feel good. My vision's a little blurry, but that's about it. My face feels a little hot, but I feel awake, and I don't really want to go back to sleep. So I probably just will go home and watch Netflix.
So questions for you that I think everybody wants to know, okay? Whenever I tell patients that I'm going to do stuff under local anesthesia, everybody freaks out going, oh my God, it's going to hurt. How bad was the pain?
Like a 3.5. It wasn't bad at all.
Okay.
And then you asked continuously if I was comfortable, and I was comfortable throughout the whole thing.
Cool. And what do you think? I mean, you've had anesthetic and you've had procedures done before. How do you feel about this time where you were able to just kind of chillax and then be able to walk out of the operating room?
Getting my wisdom teeth pulled was much worse than this. It was not bad at all.
Okay. And so tell the 7.6 billion people on Earth what you had done and what your overall experience is thus far.
I had a lower fat transfer took a little bit of fat from my thigh and put it under my eyelid, and then did the CO2 laser around my eye and a little bit like under the cheek or under the eye part of the cheek, and then microneedling with the stem cells. And the pain wasn't really bad at all. You could smell the burning a little bit from the CO2 laser, but it's nothing to be afraid of or nervous at all.
Awesome. All right. Thank you.
You're welcome.
After I see you and everything, then we can figure out what you need to do.
Okay.
Okay, just bring yourself here.
Okay.
All you need to do is follow the nectar. Just put nectar on, and you can do that today, this afternoon.
Okay.
That's pretty much all you need to do.
Okay.
Yeah, keep it on today.
Yeah, I will.
Yeah.
It's comfortable.
Good. I think it's just going to help you have less bruising whatsoever. You know, because I really had to search to find that.
Right. And then I'll start my tea today.
So tell anyone basically how long you are after surgery and what you had done.
So this is the day after surgery. I had it yesterday afternoon, and my experience from last night, I was able to, do my regular routine for cooking dinner or whatever. My eyes were a little foggy, but I could still see and fine. I was able to get a good night's sleep. I didn't need the pain medicine either, so that was good. And then I had just a regular night and just relaxed.
So you came in this morning to get the second session of Elixir. How did that feel? And let's just start with how did that feel?
Going under the Elixir for the second time was the same as the first time. It didn't feel like any heat or anything. It was just felt like being under a regular red light or in a small tanning bed.
So you've had procedures done in the past. So you're not, as I would say, a plastic surgery virgin that's never had anything done, right? Okay, so you kind of have this scale in your head of what you had done in the past, how much surgery was done this time, and the only major differential is the fact that you've also had Elixir. Do you feel that the combination of local anesthesia and Elixir has helped, hurt, far better experience? What's your overall gestalt knowing your prior experiences?
I definitely feel that going under local anesthesia is the way to go, just to be awake and you know what's going on, you feel more comfortable, and it doesn't seem so invasive. The Elixir was completely kind of soothing. I mean, I feel like the combination of both, and then also I was given a serum, like a nectar, to help prepare my skin for the surgery. And the arnica, I think, also helps. I sent a picture of my girlfriend yesterday and today, and she's like, I'm so getting it. So it's definitely been a good experience.
Cool, thank you.